Hi, I'm Chelsea. Thank you for listening my presentation. My topic is improving the doctor-patient relationship in China. And for these 3 weeks, the main job I did is the research. My research question is what causes the conflict between the doctor and the patient. I engage with many stakeholders like the doctors, the nurses, and staff in the hospital, and also the patients and their families. First, I went to the hospital to do some field research, and these are the environment of the hospital. And the hospital in China are divided into 2 departments. One is the outpatient department and the other is the inpatient department. The outpatient department is like you can make an appointment with a doctor and see him or her in a specific time. And if you are not very serious, he or she will give you some medicine and some short-term treatment plan. And for the inpatient departments, the patients are always have some surgery plans, so they have to live in the hospital for a little while. And for some really serious patients like the cancer patients, they have to live in the hospital to have some long-term treatment plans. And first, I will introduce the research I did in the outpatient department. I went to the outpatient room to have an observation in the busy time for 2 hours, and I found that there are many patients outside the room, so it's very crowded and noisy, and they have to wait in a very long line to wait for 1 to 2 hours out of the door. That makes them really impatient and more anxious. And each patient has only 3 to 5 minutes to talk with the doctor, which is really not enough for the most of them. And most of the patients are together with their family members. And I have some short interview with them, but they don't have many enough time in the hospital, so I make an appointment with them for an online interview and a small workshop online. And I talked with them about the plans and goals of the patients and the doctors. And I got some very useful insights to answer my research question. I think the main reason is that the bad communication, anxious emotion, and a little understanding which causes the conflict. First, for the bad communication, because they have limited time and the patients and the doctors have a very big knowledge gap. So sometimes the patients cannot understand what the doctors are talking about. But the patients are really curious about his or her, so they always want to ask more. But sometimes they are not very aware of their symptoms, so they cannot tell the symptom accurately, which makes the diagnosis even more difficult. And the second part is the anxious emotion. The patients are really fear of their diseases and they want to ask more. But for the doctors, they also have under very big pressure, like they have the intense work and they need to take the responsibility to the patients. So they are very afraid to give the wrong diagnosis. but the two parts of them always cannot understand each other, and sometimes the patients are not 100% trust the doctor, which makes the diagnosis even more difficult. And when it comes to the inpatient scenario, these three things become more and more serious. So next I will talk about the inpatient, because I'm not allowed into the inpatient room because of the coronavirus. But I think that the lives in the hospital must be really different from our daily lives. And I didn't have experience living in the hospital, so I did a remote ethnography with several patients. So it's like they sent me some photos about every 2 hours and explaining what they are doing and what they feel like in that moment. And they also took some pictures of what environment are they in to let me understand their context. And I also sent them some cultural proofs like the diary cards for them to write some diaries, and the happy moments and sad moments card for them to record some important moments in their day. From all these things, I got many useful data for my research. And I also had some deeper interview with the inpatient patients and their relatives. I went to the homes of some discharged patients and talked with them and their families. And finally, I got some insights, like the doctors only come to their room like 5 minutes every day, so they don't have enough time to talk with the doctors about their situations. And for some surgery plans, they can only listen to the doctors. They don't have chance to make shared decisions, and the doctor have to tell them the worst situation, so they really worried about the possible risks of the surgery. So sometimes they may have some mental health, but the hospital only cares about their physical conditions, not very supportive for the mental health of. So based on all of this research, I summarized the main reason that caused the conflict is that the bad communication between the doctors and the patients, and the anxious emotion of both of them, and the little understanding of them, and the little involved in the decision making. This is for the patients, and also the neglect of the patient's mental health. I think these are the reasons that cause the conflict. And based on this, I had my final directions. The first one is, how might we help patients more easily to receive the medical information? Because I found that when it comes to the medical knowledge, the patients are always very lack of it, so sometimes they cannot understand what the doctors are talking about, or for some some scenarios, the doctors don't have limited time to talk with the patients about this thing. So this direction is for the two scenarios, one for the outpatient scenarios, one for the inpatient scenarios. I will try to find solutions to help them more easily to receive the medical information. And the second direction is, how might we help patients engage more in the decision making? Because the patients, think that they know more about their own situation and their own physical condition. They think they need to have some right to make the decision. Like they want to talk with the doctors for their own condition and make the decision together to find a best solution for themselves. And I think I will maybe design some tools for them to engage more in this scenario. And these are my presentations, and thank you for listening. If you have something that you want to talk with me, you can contact me